We are delighted to have you on our first episode of Sunday Brunch with your doctor, brought to you by Vida Clinics. Today is a topic that truly speaks to the heart, quite literally. Stay with us, we promise it will be worth it. Whether you're joining us from your home or you're on the go, thank you for joining us today on a Sunday morning and prioritizing your health. A request to the viewers, if you have any queries now or later during the session, request you to please enter your comments in the comment section or send us a WhatsApp on 777-0000314, that is 3 sevens 4 zeros 314. We'll do our best to address it at the end of the session. Joining us today is a very special guest, a name that you all know and you all trust. We are honored to have Dr. Joel Quadros, Interventional Cardiologist and an Assistant Professor at GMC. Dr. Joel has vast experience in diagnosing and treating many heart ailments and is deeply passionate about preventive cardiology. He believes that awareness is the first step to prevention. Today he'll be speaking on a topic, don't miss a beat. It's the theme of World Heart Day 2025. Without any further ado, I welcome Dr. Joel to take the session forward. Over to you, Doctor.
Good morning, everyone. I'm here to talk to you about heart attack and its prevention. I have a brief presentation of about 15 to 20 minutes, and I'll hope we'll have some fair idea about what I'm going to talk about. So this is the outline of my talk, just the current trends, what are prevalent today, why Indians are prone to heart attack, what is coronary stenosis, in lay terms blockages in the heart, symptoms of heart attack and how to evaluate, risk factors for heart attack, women and heart disease, and I'll try to bust a few myths what are prevalent. 31% of deaths in India are due to cardiovascular disease, which is the leading cause in 30 plus age group. I don't know how many of you have read this. A 39-year-old cardiac surgeon from CMC Vellore who died with a heart attack. In ICU, I realized I was the youngest heart attack patient. This is a scenario which I deal with every day. High BP at 7, heart problems in 50s. Study lowers danger threshold from age of 12. Type 2 diabetes triggering heart attacks in the 30s, while India's youth are at risk. How sedentary culture is fueling India's early diabetes crisis. So few points why Indians are more prone to have heart attacks. In fact, Indians have heart attack 10 years earlier as compared to their Western counterparts. What is happening today is nutritional transition in India. There is lot of increase in intake of processed meat or ultra processed items which are energy dense, high salt foods, and correspondingly there is reduction in intake of healthy foods. Similarly, our air quality, ambient air quality is deteriorating. That's another factor which is contributing to Indians having more heart attacks. Socio-cultural and economic transitions. Improving economy and rapid urbanizations have led to increase in risk factors. Adverse environmental influences in utero and during infancy. Lastly, role of genetic predisposition. So basically, what is atherosclerosis? I have a small video here. So this is the heart, and over the heart there are these blood vessels, and if you see in the video, these are the red blood cells, which this is a normal vessel, presently normal, and then over a period of time these plaques develop in the vessels, and it causes blockages or narrowing in the heart vessels. And at some stage, when it ruptures, it becomes a 100% stenosis. That's a block. And that is when you get a heart attack, when it becomes 100%. So when this process happens in the heart blood vessels, it gives rise to a heart attack. Similarly, if there is a blockage in the brain, it is called a brain stroke. The same process can happen in the leg vessels. Then it is a peripheral arterial disease. So what are the warning signs of heart attack? So the first important indicator is a chest pain. But this chest pain can be in various locations. Many a times it is central in the chest, a central suffocating feeling. Sometimes it is central as well as radiating to the jaw and the neck. Sometimes radiating to the left arm. Sometimes you might not have chest pain but epigastric pain, that is in the upper abdomen. Sometimes you have a combination of all this, the chest pain radiating to the jaw and the inner arms. Sometimes you might just have a suffocating feeling in the neck. Very rarely you can have just back pain as a presentation of the heart attack. So what are the other symptoms? Sometimes you can have a breathlessness, racing of the heart, fainting, extreme tiredness. So how do we evaluate further? So the first step in evaluation is by doing something called a electrocardiogram, where we put these electrodes on the chest and you get a tracing of the heart. It is basically a electrical system tracing of the heart, and we have a fair indication of if there is any acute process which is going on in the heart. The next step to the evaluation is doing a echocardiogram. So in an echocardiogram, we have a probe which gives us an indication of the heart, whether there is any heart muscle which is affected or whether there is any valve problem which is there, and how to evaluate the patient further. After that, the third modality of evaluation, if there is nothing acute process which is happening, we can subject the patient to a treadmill test where the same ECG is taken, but this time the patient is on a treadmill and he exerts himself, and we have multiple tracings of the heart which will give us an idea about if there is any ischemic process, that is any indication for a heart related blockage which is there or not. So what do we do when we know that there is an indication for a heart blockage? So we do something called coronary angiography. So that is done in a specialized setup called a cath lab, where we take a tube, small tube, through the hand artery or the groin artery right up into the heart, and we inject a contrast, that's the dye, and we delineate the coronary arteries. So here in the figure on the left hand side it's the left coronary, on the right hand side it's a representative image of the right coronary. So we have an idea if there are any blockages in the heart based on angiography. Nowadays it is even possible for us to take a small camera right inside the vessel of the heart and find out what is the extent of the blockage, whether there is any calcium inside the blockage or whether it is just the cholesterol plaques which are there. It is just an additional modality where we can plan our treatment procedures better. So coming to all this, how do we suspect when someone could have a heart related blockage or not? Just by looking at the person. These are a few indicators, like if you have these lesions on the eye, they are called xanthelasmus. Similarly, if you have these lesions on the hand, on the elbow, these are called tuberous xanthomas. Very common finding what we see nowadays, especially in obese patients, is this darkening in the area of the neck. This is called acanthosis nigricans. Very important marker for insulin resistance. A sign called Frank's sign, that's a single earlobe crease. just gives an indication that this person needs evaluation further. Obviously, if you are obese and you have a lot of belly fat, conditions like psoriasis, they are predisposed to having coronary artery disease. So what are the risk factors? Hypertension, also called as high blood pressure. In India, we have around 220 million people with high blood pressure, and only 12% have their blood pressures adequately controlled. The incidence is 25% in urban areas and 10% in rural areas. It accounts for 57% of all strokes and 24% of coronary artery disease. What is the importance? We have to detect it early before the damage is done. It's a very simple test where you use the BP apparatus and find out what's the blood pressure. So the normal blood pressure is systolic less than 120 and diastolic less than 80. Coming to the second risk factor, diabetes. India is the diabetic capital of the world. We have 101 million people living with diabetes, with 136 million pre-diabetics. Again, 14% in urban areas, 8% in rural areas. Why diabetes is important? 2 to 4-fold increase in heart-related deaths is contributed by diabetes. What are the values? Your HbA1c should be less than 5 to be 6.5 to be normal. Fasting blood sugar should be less than 126 and postprandial should be less than 200. These are the ideal values you should target. Third risk factor is lipids, cholesterol. With high cholesterol, sometimes you might not have any indication that you have high cholesterol in your body unless you get yourself a blood test done to find out. What are the ideal levels? Total cholesterol less than 200, LDL less than 130, HDL 50 and higher, that's the good cholesterol, triglycerides less than 200. So when do you start screening for all this? It's after 18 years, once in 4 years, and after 40 years, once yearly. Coming to the next risk factor, that is smoking. Smoking is a very important and a prevalent risk factor. Anyone who smokes, the nicotine in the smoke is a very harmful chemical and it affects the lining of the blood vessel, contributes to thickening of the blood and causing heart attacks. Also, it can cause other effects like cancers, lung damage. In smoking, it is not only the person who's smoking that's affected, but the bystanders, the family members around, they are also at risk related to smoking. Another important risk factor, alcohol. Chronic alcohol consumption can cause various effects on the heart and the body. In the heart, it can cause weakening of the heart muscles, it can contribute to high blood pressure. Also, it can cause your liver damage and multiple other effects on the body. A few words about diet. All this is heart unhealthy diet, and like burgers, the pizzas, the ketchups, donuts, these are all heart unhealthy. I put this image specifically because in this image it shows that it is 0 calories, but actually this has something called artificial sweeteners, aspartame, which is again not healthy for the heart. All these processed items, very unhealthy, contributing to lot of trans fats and increased incidences of heart attack. Again, processed meat. Specifically, I put this because there's a lot of this junk food culture. They reheat oil in the restaurants, and that causes a lot of trans fat. Very unhealthy and can contributes a lot to the heart attack. So what is healthy? Anything natural, fruits, vegetables, more the natural, more the better for a healthy heart. Nowadays, we should be worried about what we eat. If you see in this report, some analog paneer, or even nowadays the fruits are artificially ripened. So be careful of what you eat. So UNICEF urges countries to limit purchase of ultra processed food. This is a recent report which came out. It also mentions about school kids becoming more obese. It's all related to the diet and the inactivity that the kids are exposed to. High sugar intake increases heart disease risk more than cholesterol, even in active healthy people. By high sugar, I mean it is not the sugar that only the sugar that you put in the tea or the coffee in the morning. It is the highly processed items, food items that you eat, like the maida items, the bread, the bakery products. All this is heart unhealthy. So India's next big health crisis, UNICEF reports, unveils shocking obesity-related trends. This is more related to the sedentary lifestyle. Nowadays, everyone's addicted to mobile or the laptops, sitting late night watching Netflix, having food addiction, which has contributed a lot to this obesity and sedentary lifestyle. We see this very frequently in children, childhood obesity contributing to various effects in the children. Another important factor which I want to stress about is stress and psychological factors. With what happens in stress is there is reduced sleep. It contributes to increasing the stress hormones, which again affects the lining of the blood vessels and can contribute to heart attacks. How do we take care of this sleep? Meditation, yoga definitely helps. If it doesn't help, then you have to consider medications. So what I mentioned to you are all the modifiable risk factors where you can do something about it. Here are a few non-modifiable risk factors like age. With increasing age, you are prone to have heart attacks. Sex, that is, women are slightly protected till menopause. Ethnicity, genetics, as I told, Indians are more predisposed for a heart attack as compared to the Western counterparts. So what do we do with all these risk factors? As a doctor, we estimate your 10-year risk of having a heart attack, and then we decide whether your risk factors need only lifestyle modification, or along with lifestyle modification, we also need to give any drugs, that is the medications. Just a word about women and heart disease. Before menopause, the hormone estrogen protects the woman to some extent, but this advantage is nullified if you are smoking, if you have diabetes or premature menopause. Why there are delays in diagnosis? Obviously, invisible markers. Sometimes diabetes might not have any symptoms, like in 50% of patients, you might not have any symptoms of diabetes. Similarly with cholesterol, high cholesterol. There is very low priority for preventive care. Everyone's busy in their urban lifestyle. And genetic susceptibility. We don't know who's susceptible because of what genes you inherit. Coming to busting a few myths. Heart attacks happen only to the elderly. That is a very, very big myth. If you have realized what I've spoken in the last few minutes, it is not only the elderly who are susceptible for a heart attack, even the young persons who are apparently fit could have high cholesterol without any symptoms, could have diabetes. So unless you get checked for it, you will not come to know whether you are having a problem or not. Second, everyone experiences the same symptoms, especially severe chest pain. Around 45% of patients might not have chest pain during the heart attack. You can have silent heart attacks. Women are not at risk for heart attacks. The statement is incorrect. In women, heart attack is a major contributor to deaths in women. Only as far as women are concerned, they have slight advantage till the menopause because of the hormone estrogen. If symptoms go away, the danger is over. That's incorrect. Sometimes there can be recurrent symptoms before you have a major heart attack. So you have to be aware of the symptoms and get yourself tested earlier. As I said, this is a very wrong thing. You don't need to worry if you are young and fit. There are always clear warning signs before a heart attack, which is not true. Sometimes, especially in diabetic patients, you can have heart attacks before any warning symptoms are there. High blood pressure, high cholesterol are always symptomatic. Again, not true. You can have high blood pressure and high cholesterol without any symptoms. So unless you get tested, you might not have any idea you have high cholesterol or high blood pressure. Heart attack is always fatal, not necessarily. Nowadays, treatment is available. Before there is a imminent heart attack, we can find out. Also, if there is a heart attack, there is treatment available to take care of it. Heart disease runs in the family, so there is nothing I can do to prevent it. That is not correct. We can do a lot of things. We can evaluate, take corrective action as far as diet is concerned, start treatment whenever indicated. Diabetes won't harm my heart as long as I take my medications. Taking medicines for diabetes is important, controlling diabetes is important, but it is not the only thing. Along with diabetes, as I have mentioned, we have to take care of all the other risk factors to reduce our risk of heart attack. I don't need to have my cholesterol checked until I am middle-aged. That is also not correct. We need to check cholesterol in the early second decade because, as I said, the process of atherosclerosis, the narrowings in the heart, in some patients starts as early as in the 20s. Aspirin can cure a heart attack. Aspirin only helps in, it's a blood thinner and can only thin the blood. It will not cure a heart attack. So don't wait for the wake-up call. Remember, your heart works hard for you every day. Don't wait for heart attack to see your doctor. Get yourself screened.
Thank you very much, doctor, for that eye-opening session. If you have any queries, as mentioned earlier, please put it into the comment section or send it to us on WhatsApp. We will address them. Doctor, we have few queries that have come in actually. So the first question we have got is, can we stop anti-cholesterol medications once the cholesterol comes down to normal?
Yeah, so ideally it should not be done because the cholesterol levels, once it is treated, will come down with medication like the statins, the anti-cholesterol medicines. But doesn't mean that it will not go up once you stop. So it is not advisable to stop the medicines, especially the anti-cholesterol medicines, once the cholesterol comes to normal.
Okay, what about the other risk factors like diabetes and hypertension? Those medications also, if they are brought to normal, do they have to continue?
So as far as diabetes is concerned, sometimes with medications, your HbA1cs and your fasting and postprandial sugars can come to normal.
Okay.
But patient has to be under continuous surveillance. Okay. And as and when required, we have to reinitiate the medicines even if you stop it temporarily.
Okay. We have another query. There has been a greater incidence post-COVID. Okay. The question was, can you throw some light on myocarditis and cardiomyopathy?
Yeah. So COVID has caused a lot of imbalance in the systems. Like COVID led to a lot of sedentary lifestyle during that period and increasing incidences of diabetes. So that has all contributed to increased heart attack during the period and post that. Similarly, if you have the COVID virus, the coronavirus in the body, it raises the inflammation levels in the body, which have contributed to the heart attacks.
Okay. Okay. There's another query. Is heart ailments hereditary? Although you may have covered it, there is a query that has come in. Are heart ailments hereditary? Both my parents have cardiac problems. At what age should I start my checkups?
Yeah, so if you have strong family history, that is if your dad had heart attack before 55 and mother had before 60 years, then should start screening right from early age. We don't know if you are having high cholesterol, so things like high cholesterol, diabetes need to be screened at around the age of 20. And then if you don't have it at 20, then every 4 years. But if you have more other risk factors, like if you are obese, if you have a lot of stress at work, then you have to screen it more frequently, every 2 years after 20 years. And then if you have already crossed 30s or 40s, definitely get yourself screened so that we have a fair idea of how to go with the treatment aspect.
Okay. Doctor, in one of the myths that you busted was uh, you can have heart related problems even if you're thin. But the people who are obese, they are much higher risk factor is there. So what is the the way forward for anybody who's obese? What would you guide them, or any obese patient coming to you? What would be your guidance to them?
So first, in obese patients, get your labs evaluated, your blood pressure checked, your cholesterol checked, your diabetes checked. And initially, we don't start medications. First is exercise. 25 minutes of brisk walk is what is recommended, and after that, we have to actually see if there are any other risk factors and start treatment accordingly.
Okay. There is a question coming. My husband got a heart attack 2 years back. A stent is put through angioplasty, but there is now a lot of bloating and leg swelling. Is there any treatment for this?
So this bloating could be related to medications. If something like aspirin can cause some amount of gastric irritation, so if it is related to medication, we can change the medicines, and we will have to evaluate. There are some medicines for gastritis which can be considered, which can give some relief.
Okay. I think those are the questions coming till now. If you still do have any questions, please drop a comment. We may be able to get back to you at a later stage. But as for now, Doctor, it was indeed wonderful and a really good session. On behalf of Vida Clinics, and of course our viewers also have put in some very positive comments. We thank you, Doctor, for your insights, and for this small gesture by you, by sharing your insights. It will help us for a better tomorrow. Please do subscribe to our channel so that you are notified about the next episode. Until next time, this is Alan Pereira signing off from Vida Clinics, where we care for your health and your heart. Take care, stay healthy, and keep your heart healthy. Thank you.
Thank you.
Done. Okay.
Okay.
Very
Okay.